Welcome everyone to this wonderful webinar with Dr. Revivajennz Medical Aesthetics. We are here to announce your brand new treatment, UltraClear. This is our virtual launch event with Dr. Jennifer Thomas-Goering. And if you have any interest in laser treatments or in skin rejuvenation, we are going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments, and also why we're so excited about this new device. We also have a promotion, so make sure to stay tuned until the very end of the webinar and we will explain how everything works. And so before we get started, let me introduce you to our wonderful speaker. I'm pleased to introduce Dr. Jennifer Thomas-Goering. She is a board certified anesthesiologist that is on the faculty at the University of Michigan. She is also director of preoperative care and anesthesiology and perioperative care service at the VA Ann Arbor healthcare system. Dr. Thomas-Goering has had her own medical spa in Ann Arbor for the last 10 years and is a national aesthetics instructor. She loves teaching and sharing her clinical pearls for good outcomes with safe techniques. And now, Dr. Thomas-Goering, if you would like to take it away.
Hi, everybody. It's Dr. Jennifer here. I want to thank everybody for coming and spending your Wednesday evening with me and learning about our latest, greatest, newest device at Revivajennz Med Spa. So we are going to be talking about UltraClear. UltraClear is a laser made by a company called Aclara, and that is in Rhode Island, made in the United States. And this is super cutting edge technology, and I can't wait to share it with you.
The first, the first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
All right. Let's go ahead and get started. Hopefully everybody can hear me. So, who's a candidate for UltraClear? Everybody is a candidate for UltraClear. So this laser technology is like so cutting edge. Again, it's ideal for treating uneven skin tone, texture, fine lines, wrinkles, acne, surgical scars, hyperpigmentation, sun damage, age spots, and overall skin rejuvenation. And what I love about this device is that it is an equal opportunity device. So it is able to be used in all skin colors. It has 3 different modes that we can tailor specifically to your specific concerns. So why would you choose UltraClear over another device? So first of all, UltraClear is a device. It is a mid-range fiber optic laser that is comparable to what you would think a regular CO2 laser or an erbium laser would be. So those are ablative technologies. So what that means being an ablative technology is that it actually removes skin. And what makes the UltraClear different is that it is much more comfortable than traditional CO2 lasers or erbium lasers. So it uses the world's first cold pulse technology. And I'll go into a little bit more detail further on in the slideshow. Overall, what that does is when we do the treatment, it is much more comfortable. In fact, you may not even feel it at all. And because of that, who wants to be uncomfortable when getting a treatment? So that's one of the benefits. It's an all-in-one solution. So it does three different things. It can do like a very superficial peel with zero downtime. It can go deeper to stimulate collagen, and it can go even deeper than that to do something called coring. It's quick and convenient, so the treatments can be as short as 15 minutes, and we can treat multiple areas, not just the face, neck, chest. We can do stretch marks, we can do scars. There are so many things that this laser is applicable to. So again, the biggest emphasis is not all lasers are safe in all skin types. So if you're a skin type 1, 2, or 3, like you can do laser, you can do IPL, you can do BBL, and you don't have to worry about having complications. And complications could be hyperpigmentation or what's worse, hypopigmentation. So what's special about this laser is that it's safe even in the darkest Fitzpatrick 6 skin types. So it treats everyone. And the way it does that is because we are able to fine tune where the laser is penetrating so we can actually skip the dermal layer where the melanocytes live. So we can do a very superficial treatment above the melanocyte layers to prevent any damage or stimulation of the melanocytes, or we can bypass those melanocytes so that we can go down into the dermis to stimulate collagen production. So it's very controllable. And most lasers aren't like that. It's just one beam straight down to the target. So this might make it a little bit more clear. So you can see the different layers of the skin. You can see the stratum corneum, you can see the epidermis, the dermis, and the hypodermis. So the 3D Miracle is our lightest and easiest treatment. So this is considered like a zero downtime, lunchtime laser, requires zero numbing. And what this laser is doing is targeting into the stratum corneum, but above where the melanocytes live. And so this is going to help lift pigment. This is going to help smooth out your texture, fine lines, wrinkles, but very little downtime, like no downtime. You might be pink the next day. The next more invasive treatment is called UltraClear. So the UltraClear is where the laser beam actually goes down through the stratum corneum, but it is targeting the epidermis and the dermis. And so you can see in the schematic here, the dermis has blood vessels. This is where we have cells called fibroblasts that live. And we know when we cause controlled trauma to the dermis, it makes the fibroblasts angry. So then they lay down collagen and they lay down elastin. Not all collagen is made equal. So first, you have collagen 1 and collagen 3. So collagen 3 is the best collagen that we want, but it will help remodel collagen 1 to collagen 3. Underneath the dermis, we have our dermis and we have the hypodermis. And so this is where the technology of laser coring takes place. So this is the world's first laser that is able to actually core out tissue. So what that means is that it has a special pattern that creates a corkscrew that goes down into the deep dermis, even to the top of the hypodermis. And what that is doing is creating a column of tissue that has been vaporized so that the other tissue grows together. So think about taking an apple and taking an apple core. corer, and you push it down and you're taking out the core of that apple. Well, the tissue has to heal by what's called secondary intention. So that space, your other tissue comes together. And so literally it like comes together and becomes stronger and lifts. Here's another schematic that talks about what the three different modes treat. So all of the modes are going to treat skin health, skin glow, texture, tone, sun damage, pigment, but it's only when we get into the ultra clear and the coring that you're going to actually see more fine lines gone, more deep wrinkles actually gone, acne scars. And so, again, you are able to get much more advanced treatments with the deeper settings. So let's talk about laser resurfacing over the years. So back in the 90s, that's when the first lasers, CO2 lasers came out. And then in the mid to late 90s, that's when the erbium YAG laser has come out. And so that is similar to what some of you might know as Halo. So the CO2 lasers, they might be advertised as like CO2 laser or fractionated laser or Fraxel, but those are all CO2 lasers. In 2007, this mid-IR fiber laser was invented, but this wasn't for medical purposes. This was for industrial purposes. And the founder discovered this mid-IR fiber laser and then started to apply it to medical uses. So from 2018 to 2021, they were working, so Aclara was founded, and they were working on developing protocols. And in December of 2021, it was finally FDA cleared. So this is a very, very, very new laser out on the market. So it was launched in April of 2022. And then, so it was originally launched for those things that were listed, fine lines, wrinkles, age spots. And then May of 2024, it received FDA clearance for other things like benign pigmented lesions and vascular irregularity, which is vascular dyschromia. So this is an example of what the 3D IntelliPulse technology is. So this happens so quickly, you can't even tell. It just kind of feels like one like little zap. But what it does is it sends a pulse and then a cold pulse. So like it stops and then another pulse. And so what these do is they stack, but your skin has time to like recoil so that that heat doesn't build up. So during the procedure, it's much more comfortable. So this is the IntelliPulse. So you'll see. So it's sending a pulse and then cold and then pulse and then not a pulse, like a cold pulse. And so it makes it much more comfortable to be able to penetrate so deep without discomfort. That also helps reduce the trauma to the surrounding tissues so that it heals faster. So that's what we all want. We all want things that are going to not hurt and have less downtime. And so that's where this device comes into play compared to other similar devices. So this is what it's going to look like. So when we do an ultra clear treatment, this is what it's going to look like. So we get this ring, and these rings are targeting the superficial epidermis. So when we have these rings here, it is targeting the most superficial part of our skin. Inside the ring is another we sometimes call them drills or points. This is where inside each ring there is another source of energy that is going down into the dermis to stimulate collagen. So you can watch this. So this is what it looks like. So we change patterns depending on the parts of your face. Your face is cleaned. We protect your eyes with laser shields. And now we're choosing our spot size, and we have an air evacuator. And then it's going very quickly. And we're creating these channels, these deep channels going down into the dermis, but also simultaneously treating the epidermis. So this procedure here is called UltraClear. So you're getting two treatments with one pass. So again, an hour of numbing, we clean the skin well, and then this whole procedure can take, depending on the area it is that we're treating, can take maybe 30 minutes. If we're doing like a face and a neck, it can take, up to kind of an hour. But you can see how quick it is. And you're able to apply it on different parts of the face. So not only is it doing skin resurfacing, but it is also, this specific treatment here is also doing skin rejuvenation because we're going deep into the dermis. So starting with the most superficial, we call this the 3D miracle. So this is something, again, staying in the epidermis. The superficial epidermis is going to take off the hyperpigmentation. So this is what that treatment looks like.
Introducing 3D Miracle, a 10-minute laser treatment that jumpstarts your skin's own natural renewal process. No discomfort, no downtime, dramatic results. It's safe for all skin tones. Visit 3dmiracle.com to learn more.
And this is one of the treatments that UltraClear does, the Aclaro device does, that you may want several of these treatments. So we know one is good, but more is better. Because this is such a light superficial treatment with zero downtime, this is something that you'll want to repeat to get the best results. So it will, again, take off that superficial pigment, but as our skin is continuing to turn over, you want to continue to get more pigment off as those skin cells continue to come up. But again, very comfortable. You do it 15 minutes, lunchtime. There's no bleeding. There's no downtime. And you can do this as often as once a month or once every 6 weeks until you get the desired effect. So these are some examples of the 3D miracle. So her hyperpigmentation is much improved. The texture of her skin is much smoother. This also can help with shrinking of the pores. Another example, post 1 month treatment, you can see all of those solar lentigos, otherwise known as freckles, are much improved. This laser is also great for redness, so that vascular dyschromia, so it really helps take down redness. It's not FDA approved to treat rosacea, but it definitely will improve the redness in your tissue. And so, does she need another one? Maybe, maybe not. It would be her choice. Here's another example. So her skin looks much more even, much brighter, much smoother. Great, to take off like little acne scars that are superficial. And getting all that sun damage, removing the tan lines off of her neck is making her neck look so much better. Does she need more? Absolutely. But you can see like a significant difference getting off like that superficial sun damage. And especially a 15-minute treatment that requires no numbing and it doesn't hurt, that's the best. All right, and now we are talking about the clear treatment. So this is going a little bit deeper. So patients that you're not worried about hyperpigmentation, I can go a little bit deeper past just the very superficial dermis to get a little bit more pigment lifted. And again, this is a 3D miracle just to show you that it is safe in even the darkest skin tones. You can see like her skin is brighter, her pores are smaller and tighter. She's got much more of a glow. So this is doing a clear procedure, so going a little bit deeper than just the 3D miracle, but not going down into the dermis to stimulate melanocytes. So you can see she had one treatment and she had some clearing. This is something called a seborrhea keratosis. So you can see it's kind of velvety in nature, it's kind of thickened in nature. So these usually take a couple of treatments. But you can see how 4 months after the second treatment, how much that is cleared. Here's a patient with some very superficial melasma. So 10 months after 2 treatments, you can see that, again, much better. On the side of the face, again, 10 months, 2 treatments. So significantly improved. Does she need more? Absolutely. Melasma is something that is hormonally driven. And so you have to go after melasma with multi-modalities, like sometimes some melanin suppression treatments like transaminic acid or hydroquinone. And it's always best to go slow with these because if you introduce a lot of heat to a patient that has melasma, you can actually make it worse. Wonderful treatment for our hands. So for those of you that came to our open house, everybody has like one beautiful glass skin hand and the other one needs to be treated still. But you can see like how wonderful this is to take off all those age spots and to, make the hand look much healthier and not like an old person's hand. The only other thing that I would add to this would be to doing some filler to plump up the hand to, again, make it more youthful. So now we're going to talk about some more moderate indications. So this is targeting some laxity in the skin and wanting to go ahead and stimulate collagen. So this is going to be our Ultra or our UltraClear laser treatment. So you can see this person had a hypertrophic scar. That's not a keloid, it's a hypertrophic scar and had some redness, and you can see how raised it is. So this is doing those deep penetrating pulses down to the dermis. You can see how much after one treatment it is flattened out, and then at 2 months or 4 months post initial treatment, how much flatter it is, and also how much, whiter it is. Here's another patient that did an UltraClear. Again, UltraClear is a combination treatment of the superficial as well as the deeper dermal stimulation simultaneously. And look at her skin. That hyperpigmentation is faded. She has more brightening of her skin. Her wrinkles are softer and she looks a little bit more lifted. And this is just 1 month. So this treatment is going to continue to improve over the next several months. It takes up to 3 months for our collagen, for you to really be able to see your collagen production. So the initial thing that you're going to see right away is that the skin texture is improved, the hyperpigmentation is improved, but this is still continuing to improve because of the collagen stimulation. So again, amazing. Like, look at how much tighter her skin is. So this is 2 months post-treatment. Again, once you do the procedure, you have to trust the process. You can't ever expect that it's one treatment and then instantly you look amazing. Even when it comes to fillers and doing fillers, it's never just one syringe of filler. It's always multiple syringes of filler. But even after that, you have to wait for the filler to settle and you have to wait for swelling to go down. So the hyperpigmentation, you can just see her skin is glowing, it's more lifted, looks much healthier. And this is what this device is about. I want to take away the stigma of, oh, you're altering your skin, or what we're doing with these devices is we're making our skin healthier. We're taking off sun damage. We're taking off precancerous lesions. We're actually making our skin healthier. And when our skin is healthy, then everything else we do to it looks better. So again, this is another example of UltraClear. So with the UltraClear, they were able to get right up underneath his eyes. You can see that pigmentation is gone. You can see his skin is much brighter, much smoother. Now, in our clinical practice, I have the ability to put in special corneal shields to protect the eye so that I am able to actually go on top of the eyelid to help tighten up all of this loose skin and get much closer inside the orbit, not just on the orbital rim, to get some tightening. And so we use these special contacts. We put a couple numbing drops in your eyes. We put these little contacts in. So I'm able to work right around the eyes in that area. Again, this is just 1 month post-treatment, so you can already see improvement and smoothing out of her skin. And this is not with coring. This is just with that second treatment, the UltraClear. This isn't UltraClear coring even yet. Again, beautiful, 20 days after the first treatment. And so you can really see like all of that hyperpigmentation is gone. All of these like deep divots are starting to fill in. So those are amazing results for only 20 days in. Okay, now we can do UltraClear everywhere. We can do UltraClear, like I said, anywhere in the body. Um, so you can really see this is 1 month after 3 treatments. So again, it's not a one and done, but significant improvement in tightening. Does she need more? Absolutely. I would say just keep going. Okay, another example of UltraClear. And so because this patient is a Fitzpatrick 4, when we do UltraClear on a Fitzpatrick 4, it's actually 2 separate procedures. First, what we do is we do the Ultra, meaning that we are using our lasers to go down to the dermis. So we're bypassing the melanocytes so that heat doesn't trigger the melanocytes to cause hyperpigmentation. After we do a pass of the Ultra, then we're going to do that superficial layer, which is called the clear. So if you're a Fitzpatrick 4 or higher, so if you're Asian or Indian or Muslim, so we have to be very careful with people with ethnicity or Hispanic with ethnicity, even if you're very fair, because of your ethnicity, it already puts you into higher Fitzpatrick skin type. So the worst thing that we can do, hyperpigmentation, we can always treat hyperpigmentation in patients, but what we always fear, the dreaded complication, is something called hypopigmentation. And that can happen when we actually destroy melanocytes. So that is something we do not want to do. So for those patients to be able to get the similar results, unfortunately, they have to have 2 passes. Again, one of the Ultra going down to the dermis, and then the next one, the clear, that's going to stay in the superficial epidermis, but you can get amazing results. So you can see she had some acne scars and her skin is brighter, smoother, and this is not the end. It's just going to continue to get better. Okay. Some more examples of UltraClear. So before, 4 days post first treatment, 7 days post two treatments. So you can see she has very minimal downtime, and you can just see like the change in the texture, especially like around her mouth, forehead, around her eyes, just significantly improved. Poor little guy had a horrible scar right there, smack in the middle of his forehead. After one treatment, after two treatments, able to be gone. So another great example of UltraClear. You can see all of that sun damage on her face, all of that hyperpigmentation, the laxity, and you can see that her skin is brighter, smoother, and lifted. Are you guys getting excited? I'm going to burn everyone's face off. It's going to be amazing. I know I said that with the Neogen, and I'm going to talk a little bit what's different about the Neogen in the UltraClear here in a minute. So again, this is just another before and after of the UltraClear. So you can see how helping to like soften those jowls and things. So those are pretty amazing results. More UltraClear 3 months after 3 treatments. So lots and lots and lots of sun damage. And I really want you to pay attention to the texture around her mouth and how much improved that texture is around her mouth. That area can be very difficult to treat as we age. You'll see our older clients will start to develop these etched in lines, and that is because we call that peau d'orange. And that's because that part of our body is the most active. So we're talking all the time, and so those lines develop as we age. So this is the piece de resistance of why I got this device. So this is called laser coring, and laser coring is UltraClear is the world's first laser that is able to do this. So CO2 doesn't do this, Halo doesn't do this. So again, let's talk about what laser coring is. I kind of talked about the analogy of an apple where you remove the core of the apple, and then this, like if you imagine that's your skin, then your tissue has to like shrink in together. And so when your skin is shrinking together and healing by what's called secondary intention, it is naturally approximating that and making it smoother and making it more lifted. Okay, so this is why I got this device. So sometimes we're all about stimulating collagen, and you can stimulate, 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 stimulate. But if you have excess skin, you're not going to be able to stimulate it away. If you have excess skin, you have to have it cut out. So that's when you need a facelift because you have too much laxity, and all the plumping in the world isn't going to take away that laxity. You have to have it removed. So in my instance, I don't know if you guys can see, but I have this redundant eye skin. I've had it like my whole life, even in high school. And so I can plump, plump, plump all I want, try and do all these energy-based devices, but guess what? It's excess skin. I have to have that excess skin removed. And some of you have been begging me to go back to residency and become a plastic surgeon. Well, I'm not going to do it, you guys. You can beg and plead all you want, but I'm not going to do it. Okay. So this is where this device comes in, is because we are actually removing excess tissue. So excess tissue on the eyelid, excess tissue under the eyelid, excess tissue in our jowls, excess tissue back in front of the ear, excess tissue right here. I'm going to core all of this out and remove that excess tissue so that it will actually grow together tighter, and it will actually start to smooth out and pull back. So when we're doing laser coring, we're doing these vectoring techniques to try and get the tissue to move back in this direction. It takes time. So I'm not quite 1 month post my procedure around my eyes and my lower face, but I've already seen significant tightening. And when I like try and distract some of the tissue underneath my eye, I'm not able to like pull it as far out as I used to be able to. So amazing technology. So you might ask, well, how is this different than Neogen? So our Neogen PSR, plasma skin resurfacing, is different in that what that device does is it is wonderful at stimulating collagen and elastin in providing collagen rejuvenation. It actually makes your skin plumper and gives you more volume. So it does tighten, it does do some lifting, but if you have excess skin, it's not going to be able to lift all of that excess skin. It's going to help plump where you need collagen support. But if you actually need skin removed, this is where this device comes into play. So these two devices work synergistically together. You don't do them together, but you can do some laser coring or the UltraClear and then go back for some more plumping with the Neogen at a different time. So you can alternate these like, one year I do this and one year I do that. So they both are very important, but they work simultaneously together, but just in a different mechanism. So what is laser coring? So it is going to show you a schematic of how it is going to make this flower pattern that is going to drive down. So you can see now it happens very fast. So this is in slow motion, but this is what it's doing. It's making like this flower pattern, and it is doing it in a way that it actually makes a corkscrew down into the uh, deep dermis and right above the hypodermis. And so over time, that skin heals by secondary intention, and then it smooths out. So we don't core the whole face, we core in specific vectors to provide that pulling back effect. So here are examples of coring. So, and when we do the laser coring, we do, like I said, the coring in different vectors, but we still treat the whole face. So we'll treat the whole face with the UltraClear. So it's not just, we just do, unless we're just doing one specific area, like just around your eyes. Otherwise, we want to always treat the whole face because we don't want any unevenness or differences in pigmentation. So amazing, 5 months post one treatment. Does this patient need more? Absolutely, but look at that. So these are for those of you that do not want to ever undergo a facelift or a neck lift. So look at the texture of her skin. Look at how much those lines have filled in and smoothed out. This is amazing. This is really, really, really exciting, amazing work. Again, that peau d'orange, this is so difficult to treat. And I actually have two personal clients that have undergone facelifts this year. And when you do a facelift just like repositions tissue. It does nothing for the texture of your skin. So they had to go back and have laser skin resurfacing. And they had with the old CO2 laser. And it took a very, very, very long time to heal. So this is 6 weeks post one treatment. So this is again that coring technique where we're actually coring out all of those lines. Around the eyes, you can see under the eyes how much smoother that tissue is. All right.
All right. Well, thank you so much, Dr. Jennifer Gehring. That was fantastic. Wow. I can't wait to get my treatment. And for everyone here attending live, we have a very special promotion for you. So attendees of this webinar will receive 15% off UltraClear packages, plus a complimentary 3D Miracle neck treatment for the first 5 people to book. So you know what that means, guys. Start booking. So if you're one of the first 5, that's a complimentary treatment. So that's super, super exciting. And to lock this in, call 734-407-7997 to book. We are standing live right now, so feel free to go ahead and take advantage of this amazing offer. And
So
yeah,
Hallie is standing by, waiting for your phone calls. So,
yes. Yes, so definitely take advantage of this amazing offer. And again, thank you so much, Dr. Jenner, for the wonderful presentation. I hope you all learned a lot. And please go ahead and enter any questions that you might have. We do have a couple in here right now, so I'm just going to go ahead and fire away. So, Dr. Jennifer, when you're ready, what?
okay.
Yeah, so here's the first one. What does the after treatment care look like?
Wow. Remember, I don't do anything to anybody that I don't do to myself, my mom, or my best friend. And I did it to my best friend, and we did not follow the directions. So don't do what we did, do what I tell you to do. Okay. So the aftercare instructions. Um, During the procedure, it's going to feel a little warm, but for the most part, it's a relatively comfortable procedure. When we are done, you are going to be hot. You're going to feel like your face is on fire. And I'm going to put you in a post-procedure room with some sterile gauze and some sterile water, and you are going to be doing some soaks on your face, at least for 15 to 20 minutes until it's tolerable for you to be able to drive home. Then, when you drive home, because it's hot. So, when you get home, what you're going to do is you're going to get yourself a bowl of water with some ice cubes in it, a little splash, like a teaspoon of or less of some white vinegar. You're going to take some paper towels. You're going to turn the TV on to your favorite movie. You may or may not get yourself a bottle of wine or a cocktail, and you're going to sit there and you're going to dip your paper towels in the icy water and you're going to put it on your face. And when the towels get warm, then you're going to put and dip it back in the ice water, and then you're going to put it back on your face. And you're going to do this until all that heat is dissipated. And so it might be an hour, it might be less, it might be more, depending on how aggressive of a treatment it is that we did. Once that is done and all that heat is gone, then you're just going to look bad. Okay. So with the 3D Miracle, you don't need to do any of those things. And you don't even need to put anything on your face. The next day, you just go about with makeup or things like that. With the UltraClear, which is the medium depth one, or the coring, you're going to see some bleeding. You're going to see some like pinpoint bleeding, and you'll kind of ooze out those little holes. And I don't want anybody to worry or anybody to think that anything has gone wrong. It's all part of the healing process because we caused some like deep stimulation. And so that will kind of crust overnight. After you've done like your little soaks, you might wake up with like little scabies on your face. Not a big deal. You're going to go into the bathroom and you're going to use a gentle cleanser. And I give you some gentle cleanser to take home. And you're going to wash your face just with your fingers, nothing exfoliating, no washcloth, just your fingers. You're going to rinse it off. And then you're going to follow with either like a thin layer of Aquaphor or CeraVe or some other post-procedure cream, and then sunscreen. Sunscreen, 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 because we don't want you out in the sun because that can cause hyperpigmentation. And so for the first like 3 days, that's pretty much what your care is going to be. And you guys know that whenever you do a procedure with me, I follow you through the course of the journey. You get a little text in the morning like, "Hi, it's Dr. Jen checking in. Can you send me a picture?" So I'm there with you the whole time, making sure everything's going the way we want it to, making sure you don't have any excess swelling. And then usually on day 3, or early day 4, I'll let you use a gentle washcloth to wash your face, and then a lot of that the pigmentation and everything starts coming off. And during that time, you're able to wear like tinted sunscreen. You're able to wear some makeup to cover up, any discoloration. And the whole downtime, the first 3 days, you look like you have a really, really bad sunburn. Again, this is for not the 3D Miracle, but the Ultra Clear and the coring. And then, like day 4, everything starts to clear up and you heal so fast. So, for those of you that have done Neogen, you can't even wash your face for the first 4 days. With the Ultra Clear laser, you get to wash your face from day 1. And then you just wait. There's no discomfort. You just wait, stay out of the sun, and wait for everything to kind of slough off. You'll notice some redness that fades over the weeks. You might notice some like little marks. All of that just fades away. You just have to just give it time. And when you're treating the neck or décolletage or other areas of the body, just know that it takes longer for this to heal because we don't have the blood supply that we have in the face. So anything from the neck down is always going to take longer to heal. So, and I'm there with you through the whole journey.
Amazing. Wow, thank you for just answering that so beautifully. Um, so let's see. Our next question is, how does the UltraClear laser compare with CO2 and Halo?
So the technology of the UltraClear laser is that it does rapid pulses. So it will do a pulse and then a cold pulse, meaning no more heat is going in, and it will continue to drill down to the patient. It feels like just like one pulse, but these pulses are so small. And because there's a little bit of relaxation time and they stack on top of each other, that's why it doesn't hurt. That's why it's so much more comfortable. And that's why you have faster downtime. The CO2 laser and the erbium halo laser, those are just one strong pulse that just goes down, and it goes down much slower. So you feel it more. And because it goes slower and because it's not stacking the pulses, it causes more trauma in that channel all the way down. So that's why you have more discomfort and delayed healing and a prolonged healing time. Great
Okay.
question.
Okay. We have another question, just asking about if they should call in to get more information on pricing.
So when you schedule with Callie, Callie has all of the pricing, but I can tell you off the top of my head, 3D Miracle is the price is $800 for a treatment. When we are doing the Ultra Clear treatment, which is the medium treatment, that is 2,900. And when we are doing the full coring, we're doing coring and Ultra Clear on top of that. That treatment price is 3,900 per face. Now, if you are going to add on the neck, along with the coring, so the 3,600, to add on the neck is 2,000. And if you're doing the Ultra Clear, 2,900 to add on the neck is 1,900.
Okay. I have one more question, and that is, how long do I have to stay out of the sun after having an ultra clear treatment?
Forever. No, I'm just kidding. Um, so this is not something that you're going to do before you go on spring break. Okay, so this is something you're going to do after you get home from spring break so we can get all the sun damage off, which also means you need to be out of the sun at least 2 weeks before you have the treatment too, because the ultraviolet radiation, the sun damage from having a tan, is going to prolong your healing. So 2 weeks post sun, 2 weeks pre sun. And I know like we all have variable times when we can do this. Again, this isn't something I would really recommend in the middle of summer, because even getting in and out of your car, you're exposed to sun. So, definitely 2 weeks without being in the sun. And in addition to that, we always say that if you're like heavy into exercising, as you're healing, you're going to want to like take some time off from doing your Orange Theory or doing your boot camp. We always, the joke is you don't want your butt to compete with your face. So we don't want the blood flow going to other parts of your body. So if you're like lifting weights and things like that, and you get a micro tear in your muscle, that blood flow is going to be diverted to heal that muscle and not your face. And we want all of the blood flow to be going to your whatever area it is that we treated so that you heal the fastest.
Okay. Well, that's amazing. Thank you so much. Well, that is all the questions that we have for today. Thank you so much, everyone, for attending. And again, thank you so much, Dr. Thomas-Goering. We can't wait to see everyone in the office for their treatments. So make sure you call in to book.
Me too. I can't wait for everyone to call Callie, and I hope everyone's blowing up her phone and getting like these great deals. And I can't wait to like fry everyone's face off.
Very exciting. Well, have a great night, everyone. Thank you again.
Thank you, everybody, for attending. I really appreciate it. Have a good night.